Hello and welcome to this special presentation on how to relieve the pain, swelling, or stiffness from chronic knee pain without drugs or surgery. And hello there, friends. My name is Dr. Vince Leone. I manage a group of chiropractic specialists around the nation, and we all focus on non-invasive, FDA-approved knee pain therapies. And we've all invested a tremendous amount of time and resources into specialized equipment and training so that we can deliver outstanding clinical outcomes without drugs or surgery. So what are we going to cover today in this brief video? Well, we'll talk about the common knee pain conditions, quick statistics on knee pain and common causes, how the different conditions are diagnosed, the symptoms, typical treatments, and then we'll talk about what we do that's different and yet so effective. So, what is knee pain, or what are the knee pain conditions? Well, it can obviously result from the knee, but also from the hip. Typically, it's due to age or injuries. Now, we have three articulating bones. We've got the femur, the tibia, and the patella. The tibia head, we have two sides of it, and on top of that rests the meniscus. There's two meniscus, actually considered menisci, which is the plural. And then we have what are called fluid-filled bursa. These are the kind of the shock absorbers. And really it's the age component is where you have either rheumatoid arthritis or osteoarthritis. So rheumatoid is more of an inflammatory condition. Osteoarthritis is more of like an age and wear and tear type. But typically we're going to feel pain right at the front. And we can also have some ligament laxity. You can see on the sides there, we have ligaments actually on the front, the back, and both the sides. But a lot of times, we'll have pain in one of the ligaments due to laxity. So there's, again, many different types of knee pain conditions, but typically what we're dealing with is osteoarthritis, and that tends to be the most common type of condition that we see in our office and that we're able to help quite effectively. So, quick stats on knee pain. Well, it's pretty prevalent. I mean, 19% of the population will experience knee pain. It increases steadily with age, and it's slightly more common in women than men. Common causes, ligament strains or sprains, right? So that can be from a slip and a fall, could be from a work injury, could be from, exercising too heavily, sports, all types of things like that. Osteoarthritis, so we talked about earlier, essentially degenerative changes. Some of these other ones, patellofemoral syndrome, it's right at the front of the knee. Don't see that a ton. Overuse syndromes, tendonitis, bursitis. Anytime you see itis, it just means there's inflammation there. So those, either the tendons are inflamed, the bursa, which are those shock absorbers, those get inflamed. We always hear about like ACL tears, right, in sports and all that. Yes, that is very common in sports. We don't see a ton of that with the general, population coming into our clinic because most people aren't running, 20 miles per hour and colliding with other huge humans. So not a lot of, ACL and PCL tears. It's usually the sprained strains or it's osteoarthritis. Of course, you can have fractures and trauma, and then gout is another inflammatory condition. Okay, so how is it diagnosed? Well, of course, we're going to take a health history. We're going to do a physical exam. We may do blood work to rule. That's usually we want to rule out rheumatoid arthritis versus osteoarthritis. And then we'd like to see imaging. We can review the imaging that you already have, or we can order out for X-ray or MRI, just depending on how serious the condition is. So what are the symptoms? Well, of course, there's pain, but there can also be stiffness and swelling. A lot of times you can hear a popping. Sometimes like when you stand up, it can be red and warm. And sometimes with that, that ligament laxity, it can feel unstable. So that's not a fun feeling at all. Typical treatments. Well, your medical doctor or PT may recommend weight loss to reduce the stress, and that's an excellent recommendation. Physiotherapy to strengthen the muscles and ligaments. For pain and swelling, NSAIDs and drugs. of course, injections, and surgery, unfortunately. And the good news is a lot of times we can save patients from surgery, or at the bare minimum, push it off several years down the road. So let's talk about what we do. It is so different and yet effective. So we call it laser knee relief. And this is a comprehensive protocol. It addresses the majority of knee pain conditions. Again, we're typically dealing with osteoarthritis, some type of ligament laxity, sometimes meniscus issue, but we get excellent success rate in the clinical outcomes. This is practiced by specialists around the country. We've helped thousands of patients with these protocols. The therapies are FDA approved, and it is considered natural, right? We're not injecting anything. We're not cutting at all, and they're pain-free treatments, and we create long-term success. So what does the protocol consist of? So this can vary a bit, but typically we're going to have either deep tissue laser therapy or shockwaves. Let's talk about each one of those. Deep tissue laser therapy. So we need to get into the joint space, and if you don't have a powerful enough laser, it won't go deep enough. So it's important to have the right type of laser. But we want to get into the joint space, and what the laser does, it increases blood flow to the affected area by 2 to 3 times, and that in turn, A, flushes out the edema, the inflammation, and B, it brings oxygen and nutrients via the blood in increased quantities, right? So if we're going to increase the amount of blood flow to the affected area by 2 to 3 times, that means we get 2 to 3 times the amount of oxygen and nutrients. So it accelerates the healing process. Another therapy that we utilize is called shockwave therapy. Now, this is a brand new therapy, or relatively brand new, in the last couple of years. What this does, it creates micro trauma. Okay, so what that means is it's going to essentially tell the body that, okay, we have an injury here, right? With this micro trauma, with the shockwave. And so what that does, then the body's like, oh, we got to, fix that. So it sends more blood flow and oxygen and nutrients to the area. And so that helps with the healing process. Now, our protocol also will use orthotics. We'll use the knee brace. Sometimes we even use what's called knee decompression. And we definitely want to use nutritional supplements as well. So now why do we do the custom orthotics? Well, because if you have flat feet, right, or super high arches, what that does, it affects how the knee will essentially rest if you're standing. So in other words, if you have a flat foot and your knee is then going to bow in, it's going to continue to increase the pressure and the stress on that medial collateral ligament, the medial collateral ligament. And so we don't want that. We want you to stand normally and have the knee sit normally. And we also may recommend a stabilizing brace to make sure that everything is in the right position as well while we're going through our process. So the goal of laser knee relief, again, blood flow to the affected area, flush out inflammation. This creates true healing and a resolution of symptoms. So is it safe? Absolutely. All these therapies are FDA cleared, pain-free. We have an excellent success rate and excellent research supporting our therapies. Now, is it covered by insurance? A lot of times it's not. Now, we're going to always call your insurance, and first the doctor, needs to do an evaluation to determine if he or she feels like you're a good candidate. But if so, then we'll call the insurance, check to see what, if any of the therapies are covered. A lot of times it's not, like laser therapy is rarely covered. And the reason why is because they consider it elective at this point, similar to, like, say, LASIK surgery. Now, you may be asking, well, then what will it cost, right? So typically we're seeing anywhere from, $125 up to $175 per visit. And then the number of visits is determined by the severity of the condition. Okay, so how do we determine if you're a good candidate? Well, we need to sit down with you, of course, and hear about your health history and what may have caused this and what you've done up to this point to try to fix it and what the results of that were. Of course, we're going to do a physical examination to figure out what we can see from an orthopedic testing standpoint, we'll need imaging, either reviewing the imaging that you have, or order imaging or do imaging in the office so that we can correlate, right? We want to know objectively what are you experiencing, or subjectively what you're experiencing, objectively what we're testing, and getting results from those tests, and then also objectively what are we seeing on the imaging to determine exactly the cause, what is the condition, and whether we can help. So what did we cover today? Well, we talked about knee pain and the conditions, the common conditions, talked about statistics and common causes, how it's diagnosed, typical symptoms and treatments, and then what we do that's different and yet so effective, which is again called laser knee relief. So what to do now if this is something that you are interested in. In other words, you have chronic knee pain or know someone that does and you'd like to learn more. Well, the good news is if you're watching this, you have a specialist in your area and in St. Petersburg. That is Dr. April Shook at the Gulf Coast Functional Pain Relief. And of course, they're serving St. Petersburg as well as the surrounding areas. And right now, they have a fantastic new patient special for patients with knee pain. They're calling it the Shockwave Special. So that's going to include your consultation with the doctor, your exam, imaging review, a report of findings, and your first treatment with the Shockwave. So it's really a fantastic special because you can find out what's wrong, how severe it is, whether the doctor can help, and if she can, you get your first treatment all for just $49. So highly recommend. If you're suffering from knee pain, call today, 727-490-6011. Taylor is their receptionist and she'll get you on the schedule right away. But I know Dr. Shook personally, and she's a fantastic doctor, has invested heavily in advanced equipment so that she can treat these tough conditions non-surgically. All of our stuff is FDA cleared and we get wonderful clinical outcomes. So go ahead and give her office call today at 727-490-6011 and get in there for this Shockwave special. So I hope this video today has been helpful and informative for you. Highly encourage you to take action. If you're suffering from knee pain, don't suffer in silence. These conditions are typically progressive and degenerative. In other words, it's not going to fix itself. So get in her office and figure out whether she can help you or not with this Shockwave special. So that's it for this brief video today. My name is Dr. Vince Leone. Thank you so much for your time and attention today, and I wish you the best in health.